So when in the early days when we first started, Lafayette Cares actually was the name. It wasn't Acadiana Cares. It was us coming together in the community, hearing about what was unfolding more across the country. We were starting to see things that were happening in Lafayette area, but it was more about hearing about what was happening in major metropolitan communities and having people or knowing people that lived in those communities. And so it was pretty much like-minded people or people that wanted to respond started coming together and tried to start to organize around this epidemic that was unfolding in front of us. So we had several meetings. Some of us, we did. Personally, when I first got involved, I went to the Hospice of Acadiana. So they were, and I went through their training, and we at CARES you could either go through their training or you could go through the No AIDS Task Force in New Orleans training to qualify to be a direct volunteer with people that were living with HIV. And so since Hospice of Acadiana was local, I went that route and was asked to serve. The first HIV client that they had at hospice I was their the buddy or the person that worked with that individual and stuff in the mid-'80s. So it was, the other thing that for me personally, what happened was I went to New York City and had heard about the play The Normal Heart. And so before I had really had a personal experience with someone living with HIV, I went to see that play at the Public Theater in New York and was just blown away, moved by it, and came back here and really was motivated by that art to be able to start to put things together. And I started advocating with the little theater to ask them to put the play on. And it took about 18 months, I guess, to 2 years to finally get around for them to put the play on. And that play really, it was the first time in my life that I saw, where you talk about art as a catalyst or art, moving someone or moving a community. When we put the play on, it was during the dark season or whatever that the theater had. So it was in the middle of the summertime that we did it because it wasn't in conflict with their plays that they had. And we had really difficulty at that point trying to get any kind of the newspapers to write an article or for anything to really get people's attention. So when we did this play, we tapped into the network that the little theater had about promoting their works that they did. And so that happened. And so the people that wrote about activities and events in Lafayette, they covered it and promoted it. And it was a huge success. It was standing room only every night that we put the play on. It was sold out every night that we did it, to the point where the community kept coming back to the little theater and asked them, and we put the play back together again about, I don't know if it was 6-9 months or a year later, that we did it again and we pieced together the actors that were all participating in the first one to do the second one. And it was not the original cast, but it was a lot of the same people came back and did it again because there was such a request in the community. And in that, it worked that using that network of promoting that the little theater had, they ended up writing articles, those people that were connected with the little theater that were on the Daily Advertiser and stuff, they wrote articles and kind of did a piece on HIV and what was going on nationally. So it was really the first article that was published, and it was all because they were promoting the play, but it worked as a way to and then after that, there was a group of people came together and tried to start another organization. So we actually had two competing organizations after that to try and do the work of with people living with HIV. So when we were doing it's interesting to see the departments that we have now at CARES were really those back then was volunteer groups. So people volunteered to be information. So back when, and part of that was you were assigned, if you were on the board of directors, you were assigned I can't even remember because we didn't even have a test back then when we first started it. So it was really just answering questions and stuff that people were, and we call the worried well is what we used to refer to them, because there was no test, so you didn't know. So it was this group of people that may have been exposed but were very worried about their exposure. So they would call, and so we had volunteers that would volunteer to answer, and we had an answering service that would forward calls, and so people would sit at home answering calls so many nights a week to try to relieve the stress and the anxiety that the worried well had about the disease. And then we had a program called the Buddy Program, which was the training I talked about earlier that has really morphed into our case management program. But it was where people volunteered one-on-one to help individuals that were living with HIV. So they would go and help get them to doctor's appointments, help keep their apartment clean, help just socialize with them, whatever, do one-on-one work with people that were actually at the time were dying of HIV, because the first 10 years of our work that we did was really about trying to help people die with dignity or help people through those last stages of their life. Well, there was not any response from most of your traditional institutions. So whether it was the hospitals or medical centers or spiritual churches or religious groups or the government was all very, very slow in responding to this epidemic. And some of it had to do with just the newness and not really knowing what was going on. And some of it was the fact that it was affecting people that were really on the fringes of society. So, what we know today as far as the LGBT community didn't exist back in those days, and HIV was a real driver of the larger community knowing about LGBT people and stuff. Because of that being on the fringes, there was no real people that were ahead of the communities and stuff to be able to go to decision makers and say our people are sick, they're dying, because it was IV drug users and gay men, and people didn't even know a lot of people didn't even know what that was back in the 80s and stuff. And they had a lot of judgment and moral stances that they had with that particular population too. So those were all drivers of what kept the traditional institutions from responding, which then resulted in organizations like Acadiana Cares having to spring up all across the country because they were not responding. So groups of people that were having loved ones or family members or friends or whatever came together to do something, and this was kind of like a phenomenon that happened, and it was happening in every major little town and major metropolitan area across the country that in response to this. And as a result, these organizations are all in place. A lot of them are still in place and have moved on and broadened their scope of work because they had built these infrastructures that were very effective and ended up becoming very professional in the things that they were doing. I mean, you know, we don't really have. I don't really have a date. I have a date of June the 11th, 1986 was when they officially signed, and they put the articles of incorporation together. But you know, we were meeting, and the community was meeting probably a year before that in getting to that. You don't just, you know, you're not so organized that you have an articles of incorporation right away. So it took a while to do that, and it was, you know, so that was done in '86. We weren't officially a nonprofit until I think it was '89. So it took from doing the articles to getting us to a nonprofit with the IRS was a 3-year process. And in between all of that, we were also helping and working with people that were very sick with HIV. And so, you know, we had talked earlier about the organization and the groups and stuff, but you know, those backpacks that we carried around with all the information, it was like these departments or these silos that we were working in were in our cars, because we would typically go meet people at hospitals where they were being diagnosed. The first number that I remember of an official number of people living with HIV in Lafayette was 11. Was seeing a state report that showed Region 4 Lafayette having 11 people living with HIV. You know, today there's about 2,100 people that are living with HIV in this region. So that was my first memory I have of of an official number. And really what was happening too at that time were so many, the original wave of people were a lot of people that had left this area because of discrimination and oppression about them being homosexual, and left to go to metropolitan areas where they would be more accepted and have more, you know, open lives. And they were coming back here to die because they were so overwhelmed in the cities that people were coming back to their families for the last months of their life. You know, another statistic at the first statistic I remember at the same time finding out about the 11 people at the time, when the other statistic was the lifespan of someone from the time they were diagnosed to death in Louisiana in this region was 9 months. So that was the other big heavy thing that we dealt with and stuff, but that was the average. When someone found out 9 months later, they were usually dead. Some of the big roadblocks was that, you know, at the early days was that there was no cure. There were lots of things people were trying to do or that we had heard about, but nothing was, you know, it wasn't until the mid-90s that that they came up with a treatment that was working and stuff. So for those first, 15 years, it was really just, trying to help people manage the disease as best they could. The obstacles were probably the fact that there were so many of us that had been doing other things with our lives before this descended on our community, that many of us, started learning about HIV and researching and finding out. So many times, as someone that was, had no credentials or no official job or anything to do this kind of work that you would do, a lot of times we knew more about what was going on than the physicians did, and so that was intimidating. But it was also dismissive because, well, who are you and who do you know? and it was challenging at first, even to try to get into the hospitals, where instead of sneaking in or knowing that you had a friend there, that we went and tried to work with the administration to be official volunteers, and there was even a reluctance for us to do that. Now, what ended up happening was, when people were having, were being diagnosed in the hospitals and were having just, meltdowns about it, the hospital really didn't know what to do, so they ended up calling us, and that's really how they called us to try to come and fix things, and that's kind of how we started to get into hospitals and stuff like that, was that we ended up coming with our backpacks full of information to hand out to family members and the person that had just been diagnosed, because we had, scratched and scrawled and, did all kind of things to try to get these brochures, and we'd run back and forth to New Orleans to get stuff from No AIDS Task Force over there, because they had gotten funding before we had gotten funding, so we would try and pull as much stuff as we could for free, because we really had there was no funding at the time. Our first funding, official funding, didn't come until '89. So from 85 until, for 4 years, the most we would have these jars that they would put up on the bars and gay bars and stuff. People would put quarters and things like that, and then we would have fundraisers, but they were really small, not really big deals. Most everyone, that volunteered used their own money to pay for everything, whether it was, driving to New Orleans to get literature, or, paying to get someone to a doctor's appointment or anything. It was just, we were all paying for that out of our pockets and stuff like that. Nobody was being paid, or there was no really coverage to pay for stuff like that. So that first funding came from the Office of Public Health, and it was to fund a part-time administrator and a part-time assistant administrator. So they didn't even pay for full-time positions. It had to be, but it was $23,000, and we thought we had hit the lotto, but it. So at the same time, we had negotiated with Lourdes, Our Lady of Lourdes, for office space on the corner of St. Landry and St. Mary in the orphanage. So we had already been kicked out of we had gotten somebody to give us an office on University, and we spent all weekend. We went in on Friday because we all had jobs, so we spent the whole weekend wiring telephones, and it was like a reception area and 2 offices, and we spent all this time getting it ready. The big debate whether or not we put the sign up of Acadiana Lafayette Cares and stuff, but we did all of that stuff, and then Monday morning, when the tenants all came in, the people that owned it called us at the end of the day Monday and said we had to take everything out because they were uncomfortable with us being in there, so we had to go and move everything out the next weekend, and so we had, we're looking for a place and stuff, and we ended up, Our Lady of Lourdes gave us the first floor of one side of the orphanage. Was our first official, and at about the same time we got that funding from the state, so that was able to fund that program. But the whole organization was really it was an organization-based, a volunteer-based membership, and so all of the members at the time had voting rights, and so when we had meetings, it was all of the volunteers would show up, and they all had input and say about how and what we were going to do, which, if you've ever participated in that, can be very hard to work through sometimes. So it was, to say that we officially started in '86 was probably such a stretch, because all of that was, we were working with all these volunteers and stuff to try to pull this off, and to come up with the articles. Initially, Randy David, that had a career working at the city of Lafayette. Randy was one of the original members, signed the original Articles of Incorporation, and he came back on the board probably about 6 years ago, maybe. One of the original members is still on our board, but he had this big hiatus in between that and stuff. Randy was on the board. Rusty Westweber, I don't know, he was from Scott. I think he's since passed. Emily Bell, who had come here, I don't know where she came from, but she had come here to open the Metropolitan Community Church, and she was on there. There were these two women I knew them as Johnny and Mary. They're on the original articles. They were school teachers and were also a couple, and had to really be very subtle in the stuff that they did because of their jobs as school teachers. But they were workhorses. They did a lot of behind the scenes work and stuff, but they also worked with individuals. But they had to be very careful about how public their involvement was. But they took lots of chances in doing that. All of these people were people that had just come together out of the community. So, we didn't have any doctors, we didn't have any nurses, we didn't have all the people that, we would refer to them as those people with the letters at the end of their name, because you had to have those letters at the end of your name to be able to be legitimate when you would go and meet with people about what you were doing. And so that was always a challenge, because we knew usually more than what most people knew, and because we didn't have the letters at the end of our name, they would dismiss us as not knowing what we were, or they'd want somebody that had letters at the end of their name to be able to, so they had authority or whatever. And so it was a big deal for us to try to recruit and find people with letters at the end of their name to get involved. Sarah Brabant was one of the first ones that, and we used to tease her about that when she first came, but it was difficult. And they had, there was another organization that ended up starting, and I don't know, I'm trying to remember, I'll have to go look and see what it was, but after the Normal Heart and after we had been doing things for quite a while, this group came together, and it was a group of all the people with letters at the end of their names. So they were trying to, and they were going to, CARES was just a bunch of, just volunteers or people who really didn't know what they were doing. So this organization came, was trying to take over everything. And when they kept pushing, the people that had been paying attention to what we were doing went to them and said, we don't understand why y'all are trying to reinvent the wheel when these people have been doing this for several years, which was when we got that money. So that was, anytime money's involved, then that's power and that's all these things. So that was a big issue when CARES had been awarded that $23,000. And so we had to work through a lot of that. And that organization ended up, those people that were really genuinely wanting to be part of something ended up migrating over to CARES in the early 90s and stuff, and helped move CARES along from basically a volunteer membership organization into more of a professional organization. Well, the big thing was when they passed laws in Washington, D.C. So the really huge thing was the Ryan White Act. So, if anybody looks into the history of Ryan White, he was this young teenager that was infected. He was a hemophiliac and had been infected from a blood transfusion, but had been severely discriminated against because of his HIV infection. And so many, Elton John, Michael Jackson, all of these stars and stuff rushed to his side and to support him. So that was a big, and for me, it was a two-sided thing about, it was like people would rush to this kid who they considered to be an innocent victim, where IV drug users and gay men were somehow, responsible for their infection. So you couldn't rally and make them heroes, but you could make this child a hero, which was, and I was seeing heroic behavior from people every day that were true warriors and true heroes that were being dismissed. But anyway, that's the community rallied around this kid. And he was a hero too. I mean, he did some incredible things. I'm not taking anything away from him, but it was hard to take that. So anyway, they named this new legislation after him, and it still bears his name. It's the Ryan-White Act, and they put money behind this act, this legislation, to fund programs throughout the country. They did it in a way that was the major money went to major metropolitan communities. So these big cities got the lion's share, but they also had the lion's share of the infection. And then they funded other areas. There was Ryan-White Part A, B, C, and D, and it all represents different areas of funding and stuff that goes. So that money has continued to be the driving force and being able to put in place the support system and also the care and everything that's been in place since the early 90s for people living with HIV. So that was a huge change. Then in the mid-90s, when they started doing combination therapies where they started combining different medications, realizing that the trick to trick the virus was to bombard it with medications. Three different medications was kind of the key number, so that it was constantly trying to mutate but couldn't, because you'd then bombard it with another medication and it would start trying to adapt to that, and you just kept doing that. And so that suddenly people started, getting better. I mean, it was working. The virus was not being able to do its damage because the medications were working but it was a slow start too, because we had, the tragedy was that we didn't know what the dosing was. So a lot of people, the virus was getting depressed or getting shut down, but at the cost of kidney and liver and other systems in the body, because we were bombarding it so heavily with these medications. We've since, and that's the beauty of it now, is that today most people take one pill and it comes with hardly any side effects, which is, a miracle for those of us that have seen where this whole process and stuff, how it's gone. I think that the community, or especially the LGBT community, HIV gave a lot of community people backbone, in that seeing and being confronted with this disease in your friends and loved ones made our community stand up and say, we're going to do, that we can't let this continue to happen. So people that typically would not have come out or involve themselves with something did and responded. So that was a big thing, that the community rallied around this work in different ways, but they did rally around it. I guess too, the medications were, you can't downplay that. It was a huge thing that people suddenly had hope that they were going to be able to live. And that was a major involvement. It was a major thing because suddenly we had people that wanted to volunteer and do stuff work with us at Cares, but you could, someone could show up for a meeting and 6 weeks later they were dead. So it was really hard, or they would be so sick they couldn't consistently do anything on a regular basis. So, to get involved and to do things, you need to show up on a regular basis, and they couldn't. And then suddenly, when the medication started working, people started to show up on a regular basis, they could show up and they wanted to get involved. And it was a clumsy thing at first because some of the people that were rallying to volunteer or new on the scene didn't realize what a phenomenon this was, that these people that had been sick for so long suddenly were able to participate and wanted to participate, and who was more credible to know what needed to be done than the people that were living this disease. And so that was a big deal. I think just not only the fact that people were living, but the fact that they could now participate in and have say about what and how care and treatment and programs and organizations like this organization should be run, which was a really big change. Well, I served on the board of directors for the National AIDS Housing Coalition, so we were advocates for housing. And the really big thing that was a huge issue where, we had money to possibly purchase people's medications, but if a person didn't have a house to live in to store the medication, then how were you going to take your meds, especially back in the day when meds had to be refrigerated and all this stuff. So we really started advocating, and our call was that housing is healthcare, that you cannot have a situation where someone has health care if you don't have a home, if you don't have a place to go to. And so we started really advocating, and it worked in that people started listening. And so HUD responded by creating a whole program called HOPWA, which is kind of a boutique housing program within the bigger HUD program. It's called HOPWA. It's an acronym for Housing Opportunities for People Living with HIV. So it was, and it went across the country. Really the big thing was funding in major cities, because that's where the epidemic was. One of the things that I tried working on or really concentrating on was changing the formulary when I was at the AIDS Housing Coalition, because they were still basing the formulary for funding on cumulative cases of HIV. So that meant you were counting people that had died sometimes 5 or 10 years ago to decide how much funding was going to go to a region. And so it meant that because the epidemic had migrated in different places, and the majority of the epidemic was in the South and a lot of it was in the rural areas, you typically have not real supportive decision makers in those rural areas in the South, so it was hard to find a legislator that was willing to take on that challenge of moving and changing that formulary, because it meant possibly the major metropolitan cities would lose funding because we wanted it to move to living cases of HIV instead of cumulative cases of HIV. So that was the big fight that we had, and we ended up getting it changed. It took a long time, and I had already gotten off the board, and it was several years later before it actually happened in Lafayette, Louisiana, where there was additional funding for HIV housing because of that change in the formulary. So in 2006, we were looking for a place to move. We had moved downtown, and that was not working out for us. And so about the time that, and we were pretty vocal about some of the challenges we were having with the housing that we had, or the office we had downtown. So people knew we were looking for a place to move. And the Central Control is a Louisiana organization that owns nursing homes across Louisiana. Their central control is in Pineville, Louisiana, in a very assuming building that this man started this, one nursing home at a time and built into this big, huge corporation. And so they had built the Camelot in Broussard, and they were moving this nursing home to Camelot along with their certificate of need. If anybody knows about nursing homes, you have to have a certificate of need to be able to bill and do everything that you do. So they were up and moving to this new location and wanted to donate this piece of property to a nonprofit. And so about the time I heard that it was available, they had already offered it to, I think had offered it to United Way and Catholic Charities, and both of them felt like they weren't willing to take on the project and stuff like that. So about that time I heard about it, I started trying to find people that knew them and make an introduction for us, get on board. And it worked out that one of a CPA that we had worked with for our auditors worked for them. So we received this facility on Martin Luther King Drive at the end of 2006. It sits on 5 acres. It is a 76,000 square foot of building, two separate buildings. So it allowed us to, many things. One of the first things it did was gave us capital and gave us something the bank would want to take away from us when they let us borrow money for the first time. So that was a big deal. We had never really we had contracts and we had things like that, showed that, because our budget had really blossomed into a pretty sizable budget by that time, but we didn't own anything. I mean, we owned some computers and things like that, but when this property was given to us, it was a multi-million-dollar piece of property that gave us something to be able to work with as far as the bank goes. Also, too, we were able to write grants to be able to say, this is what we have and we'd like to, make this transition into this multi-use facility. So that was one of the big things. I mean, that was a huge thing that happened for us there. It was, we were able to start to imagine what else could we do besides the work that we were doing in HIV. So that got us to thinking about, if we could and, if we would or whatever, how would we improve the programs that we're doing. So our prevention program was basically telling people, to wear a condom and try to educate them. And we were talking to high-risk populations, that people were homeless, substance users. Those were all high-risk people that we were trying to prevent from getting HIV. But suddenly we had the ability to be able to address directly those situations or those drivers that were putting people at risk. So, people that were homeless, that were making decisions based on needing a place to stay, a lot of times knew that they were not making the greatest decisions, but needed a place to stay. So they, engaged in things that they would not normally do, but needed a place to live. And so for us coming in and being able to provide housing, so we immediately started looking at some of the square footage to become transitional housing and permanent housing for people. So we started looking at building, we started looking at trying to get funding to do conversions and stuff like that of the property into housing programs. So substance users, we looked at some of the square footage and became willing to commit several thousand square feet. We've, holistically are trying to look at where we need to cover other areas or wraparound services for people living with HIV, got us it started there, looking at how we can fill in the gaps and stuff that traditional institutions are not providing for people living with HIV. And in that, we created this kind of a culture here in trying to look at how other individuals and other areas of the work that we can do here and bring that holistic look into it. So we've gone from, just to give you an example, in the early 2000s, we had a budget that was a little over $100,000 that was going toward housing. Today, our budget for housing is about $1.2 million that we have. And it's not just for people living with HIV, but it's for people, the larger community of people that are dealing with insecure housing or homelessness. And so we've opened up all of that and looked at, initially, we were trying to get people from, preventing people from getting infected with HIV, and in looking at those populations that were most at risk, we started building programs that kept them from being at risk. So we've developed housing programs to keep people from becoming homeless, or if they were homeless, getting them off the streets and getting them into permanent housing. Same thing with substance use. That's a huge driver of the HIV epidemic. So we started looking at how can we prevent people from becoming infected. So we created substance abuse programs and tied our housing programs into long-term recovery, so that we could stay with them more than 28 days. We can stay with them and work with them and support them for over a year in our housing program that's tied into our substance abuse program. And then in that too, we were looking at and started looking at medical care, and in prevention, it was, are people getting the kind of testing they need for diseases that put them at risk for HIV. So we started looking at, and we had never done medical care, so we created a clinic for people that were at risk for HIV. So the LGBT community was a big driver of that. And then as we started needing a doctor, and we needed a doctor for our substance abuse program, we needed a doctor for the testing we were doing, and then started looking at how people, what standard care at the time was, soon as you find out that you're HIV infected, you should get into care and get on meds. And what was happening in this area was that people were finding out they were HIV positive, and it was taking sometimes 4, 5, 6 months for them to have their first appointment to get medication. So we said, this is not acceptable. So we started looking for funding and being able to open a clinic that would be able to address that. Well, in doing that, some of the funding and the ways that we went in that direction created medical care for the general population. So we now have primary care that we do. We specialize in HIV care, but we also do, we have a podiatrist that is in the clinic. We have a sleep study doctor that's in the clinic. We also have a really big psych program. So we have 2 full-time nurse practitioners that work with patients on their psych meds and being able to help them manage things. We're also in the new big thing that we're doing is opening a pharmacy that we own, be able to generate revenue, to be able to support the work that we do. So that was, and a lot of the stuff that we do, just as an additional, is that we've looked at programs and tried to build programs that create revenue for us to be able to then fund the things that we do that don't have a source of revenue or short in the revenue that we have, to be able to cover those individuals and take care of them in ways that they need to be taken care of.